All right, since the recent outbreak of dengue in Jamaica, several persons have claimed that papaya leaves have cured the disease. But what does the medical fraternity have to say about this? Here to discuss this issue with us is CEO of Mahogany Health and Fitness, Dr. Winston Dawes. And on the phone, I think in a short while, we're going to have the operator of Bioregeneration Integrated Medical Center, Dr. Janice Simmons Fisher. Good morning, Doc.
Morning.
Morning. Good to
Morning.
have you.
How are you? Good to have you.
Thank you for having me.
So, Dr. Dawes, is it true? Let's start there. Can the papaya leaf cure, if not subside, some of the symptoms of the dengue?
Yes, and they have done some quite a lot of research on it, and it does help in reducing the symptoms, which would be the pain, the fever, and they've also found that it has an effect on the platelets. And one of the big dangers of dengue is that it destroys the platelets. The platelet count drops, and you end up with hemorrhagic dengue, which is what kills a lot of people.
So it has the properties to increase the platelet count.
Increase the platelet count or
Does it stop-
prevent,
And what about the bleeding under the skin? What effect does it have on that?
No. It's because the low platelet count where you get the bleeding
That's
under
what
the skin.
causes the bleeding.
Yeah.
I see.
And that's
Do they know what the properties are in the papaya leaf that make it so?
they have a lot of antioxidants, and that tends to improve the immune system. So that might mean that it destroys the virus quicker, and so it doesn't have a chance to depress the bone marrow.
Wow. Dr. Fisher, you say you know of 30 testimonials of people who are in intensive care with hemorrhagic dengue who were discharged in 2 days because of the papaya leaf. Tell us a little bit more about that.
I'm sorry, I missed it a little bit what you had asked.
No, I'm saying I read here that you say you have knowledge of 30 folks, testimonials who had hemorrhagic who were able to leave the hospital within 2 days. Can you expound on that for us?
Oh, sure. I wanted to kind of put a context around how I work because I stand completely with the medical association and with the ministry because I don't think anyone can recommend something they're unaware of. But I think as the data is coming out, you have to draw a line in the sand and move on from here. So I'm a medical doctor, as Dr. Dawes. We're both trained at the University of the West Indies, and mine is going 17 years ago. Additional to that training, I spent 4 years studying the medicinal chemistry of plants. And I know no one else in Jamaica who has done that. So I'm both a physician and a doctor of natural medicine. And I figure I have a unique voice as I've practiced in this, what we call integrative medicine, for going 15 years. And most major universities now have an integrative medicine division. There is Sloan Kettering, Mayo, Duke, most major universities. That being said, I know that I'm the only one here. And so, it is that I understand that the medical fraternity doesn't necessarily study plants. It's not part of our standard curriculum. That said, most doctors will not be aware. But as the information is coming out, I do think that we have to act on the data, and we have to be scientific with that data.
Dr. Simmons Fisher, I wanted to get a little bit, because we have a limited amount of time. One of the concerns of the medical fraternity is that we're saying to people that it can work, but not everyone knows how to use it. So some people are saying boil, some people say put it in the NutriBullet, some are saying beat it up. And I know that's a challenge with plant-based medicine, knowing exactly how to use it and in what amount. So what's the challenge here with the papaya leaf and the dengue?
Right. I think there is challenge around anything that you use to treat, and that's why there has to be some sort of guidance, whether it's public education or otherwise. The WHO has actually issued guidelines on how, and have said they will work with nations who want to use traditional medicine. And the guidelines are fairly standard. One is identification of the correct plants. Two, it has to do with making sure that the source of the plant is organic, it hasn't been sprayed. And that also those who are on medication, who are pregnant, who are breastfeeding, who are elderly, have some sort of medical supervision and not proceeding without that supervision. But again, I usually say that there is not any one single way to use. And then the papaya leaf has actually been subject to a number of studies. There are over 30 patents on it, and it has come out showing great safety and great efficacy.
Dr.
Whether
Dawes,
or not,
all right, thanks, Dr. Simmons. Dr. Dawes, what I wanted to hear from Dr. Simmons Fisher, so I'm trying to see if I can get it out of you a little bit more quickly, is how people who are watching now and they're hearing, because I think that's a fear of the ministry, that people are just going to get up and not
Start
go to
using
the
it.
doctor
Right.
Yes,
and not go to the hospital and try to self-medicate and themselves not understand how to use the papaya leaf.
Yeah, one of the big things about when people start self-medicating is that they delay going to a doctor
Physician.
or a hospital
Yeah.
when things start getting bad.
Yeah.
And still the guideline is if you're having severe pain despite of everything, if you start bleeding or when you scratch yourself, you see blood under the skin, then that is something very, very serious. And it's not the time that you're going to try using papaya leaf on your own.
Yes. Yeah.
That is a big danger.
And there is no notion that says it has to be an either or, right?
Yeah,
There is,
no.
You can
Yeah,
use both.
Yeah, use
No?
both. And even the Ministry of Health guidelines to dengue, they have used paracetamol if it's mild. It's when it gets serious, what you must look out for is signs of bleeding, severe pain, if you're extremely weak or high fever, then don't self-medicate. Go in and see your doctor or the hospital and make the proper arrangements for your health. It's not the time you're going to try and do any guesswork.
Yeah. I see the president of the JMDA saying he's never heard of papaya leaves being a remedy for dengue. Dr. Tufton is urging Jamaicans not to experiment if they identify dengue-like symptoms. Dr. Simmons, would there be further debate with the JMDA, perhaps with the government? Can there be some consultations where we can arrive at maybe some next steps with a view to using this more broadly, if in fact we find out that there is some benefit here, which you are saying we have?
right. I think what is lost is the ability to really engage with the public. And I think most corporate companies have a platform for engaging. And I think what is happening is that with the patients feel distance. And I think what we have to do is not lose that ability to really go in and listen and say, listen, I hear you're doing this. These are my precautions around it. And these are the recommendations that I will give you. You know, it's not going to stop a dehydration. It's not going to do this. But to really find ways and means of truly connecting and not losing the opportunity to really show great care and great leadership in this time. But it is that the information is coming out more and more, and it's partly being brought out by the people. And so when I was asked if I knew about it, and I shared, I hear some data, I know the profession would be taken aback. But we have this great opportunity here to do proper research and to really do justice by really talking with people and educating them around the limitations of the papaya leaf, around the limitations of everything, and so that we can actually not lose the confidence of our people.
And can you tell me very quickly, because we have to go, what has the data shown you?
Well, we have actually worked out to the exact receptors how the papaya leaf actually inactivates the virus. And so there are flavonoids, antioxidants, as Dr. Dawes alluded to, that bind to a particular protease called NS2,3B. We've worked out how it actually can improve platelet count and decrease hospital stays. So there are clinical trials. There are countries such as Malaysia that have done extensive research and have made publicly that they endorse it. The WHO has also given their guidelines. India and Sri Lanka have done extensive studies. So there is no need to really validate those things, but we can look at it in our population and we can catalog the experience of the clinicians and of the patients who have used it to really present the data on what has been done and how it has affected and how it has impacted the situation of dengue in Jamaica.
Okay. Thank you very much, Dr. Simmons. Appreciate your
Thank you.
sharing with us this morning. I'm reading here that we're looking maybe to a fast-acting pill or medicated syrup in the future from the papaya leaf. Could be, I think, Doc?
Yes. One of the things, is that every time we discover something new,
Yes.
people try and make it proprietary and put it in tablets. They have the papaya leaf, you can get it easily. It's in a lot of homes, although you're there saying that the men don't like it around their homes.
Yes, my mother tell me, let's see, let's chop it down.
That's a myth. That's a myth. That's a myth.
So they don't have to worry about it.
No, they don't have to worry about that.
All
But again, it should be part of a healthy diet. You can have the papaya fruit also has positive impact on a lot of these diseases.
Interesting.
So,
I was not a fan of papaya, but I may just have to
become a fan.
yes, no,
Okay,
it's
Dr.
good.
Dawes, I hear
Sure.
you. Loud and clear. Thank you very much.
Sure, it's a pleasure.
Dr. Winston Dawes, CEO of Mahogany Health and Fitness and operator of Bioregeneration Integrated Medical Center, who joined us by phone, Dr. Janice Simmons Fisher.
Coming up, how to handle those holiday blues. And remember, Smile Jamaica goes brata. We're up until 9, so stay.